today. We've got we've got proposed legislation coming up to the Parliament soon. It's being touted as same job, same pay. There's going to be lots of implications. One of the implications is going to be for providers such as Mable and platforms that allow people to individually employ on flexible ways, flexible hours, flexible pay structures, people to come and provide service for them. It actually also allows people to operate as sole providers with the protection of a bigger organisation behind them. People with a disability quite often go on these platforms being aware that they don't work at the same level as someone who doesn't have that disability, who they need different modifications and support. So they might be doing the same job, but they're doing a job that might take someone an hour, it might take them 3 hours, they may only be able to do part of it, whatever. Have you had any discussions with the government that in disability we already have a thin workforce, and that if any of these positions became same job, same pay, that you'd have to pay absolutely everyone the same amount of money despite their disability making them to be able, they're not able to be as productive? I mean, that's just going to lead to them not getting jobs, which is not what we want. We want these people contributing. We want these people doing what they can in the environment they can. Has the agency had any discussion with the government about these sorts of industrial relations reforms which will push people with a disability possibly out of the workforce?
I can say, Senator, that would be the Department of Social Services' role to be having those conversations. We obviously have ongoing conversations about the fact that, as you would know, that the employment outcome is kind of not where we would like it to be within the scheme. We have a lot of conversations through colleagues in Prime Minister and Cabinet at the moment in relation to the work they're doing around the care economy, because, as you rightly point out, we don't have the workforce that we need into the future to be able to support 610,000 participants as we currently have. But I might see if Ms Mackay has anything she wants to add. She's been involved with the ministers deeply trying to bring together some of these workforce issues right across the scheme.
Thanks so much. There is focus around the care industry as a whole and the workforce that will be required, as Ms Falkingham said, into the future to support people who need different segments of that market. And certainly we talk a lot to providers about some of the issues they have, and often workforce issues is something that they raise with us as a concern they have, particularly in thinner markets, getting access to the required workforce. We also obviously need to talk a lot with participants to find what they need and how they engage with their providers. So we're talking with the department around workforce issues going forward.
Which department? Sorry.
DSS.
Right, okay.
Around workforce issues, and talking with employee representative groups around what are some of the issues and whether they're around recruitment, training, engagement, the nature of their employment. They're all factors that we're thinking about and talking with others about in terms of how we can make the system as a whole more resilient for the future.
Yeah, I mean, DSS is also responsible for disability employment services, and I don't think there's a person in the world who would say they are a fantastic service. In fact, you'd struggle to find someone who said that. Do you think it's worth the agency actually having a direct discussion with the department involved with workplace, employment, workplace relations in a bid? Because, if DSS are quite happy with DESs, they might not be thinking when we're talking about the agency wanting to get people with a disability into work. That's one of the outcomes that we've always wanted to see as part of the insurance model, that perhaps the agency should be engaging with departments other than just the Department of Social Services?
So we are talking with the DSS around workforce issues, and the Department of Premier and Cabinet is also thinking about workforce issues across the whole sector.
Yeah, I'm worried about what the Department of Workplace Relations and whatever Tony Burke's area is called, because all the department names have changed. I'm worried about what he wants to bring in under his same job, same pay, which means not that men and women get paid the same. It means if I left TAFE doing a degree 6 weeks ago, or I'm an autistic adult who wants to get a job as a cleaner but doesn't have the cognitive function or the speed at which I can employ another cleaner, I have to pay them both exactly the same. And so do we think the autistic woman who's going to take 3 times as long to do a job is going to get paid the same as someone who does the job a whole lot quicker, because that's what the law is going to mandate? They've got to be paid the same money. So we are going to remove people with a disability under this reform from the workforce. It is absolutely, because it's the culture and capability of the agency.
Industrial relations.
Yeah, and the culture and the capability of the agency, and I'm chairing here, thank you, Dr. Ryan, but the culture and capability of the agency, your absolute mandate is all based in people with a permanent lifelong disability insurance scheme to improve their life skills for their best possible life. So your role is more than DSS. Your role is making sure that all of government provides opportunities for people with a disability. This reform will cause great problems towards people employing those with a disability who require special supports. Is the agency, any of you, anyone, talking to an agency, a department other than DSS? Has this crossed your radar?
Senator, DSS is finishing a round of consultations at the moment with the with community that will input into a range of different disability employment pathways. So I'm happy to take that up with DSS and have a conversation with them. I'm not across what you're speaking about at the moment, though.
Well, it's in the paper almost every day. It's called Same Job, Same Pay. Tony Burke's suggesting it, and basically that means everyone doing a job as a cleaner at a company has to be paid the same money, whether they've been there a year, whether they've been there 20 years, whether they've got a disability or they don't. And this is going to have a big impact on companies and organisations being able to employ someone at a different rate or under a special circumstance because of same job, same pay. This will make it more difficult for people with a disability to get a job in mainstream Australia. That's the reality. The agency has a responsibility to encourage people to live their best lives through choice and control, and that choice and control might be, I want to get a job. So the agency has an obligation to talk to all departments that are going to have an impact on that. So take it on notice. Perhaps the legislation is coming in to the Parliament in the next week, and I think perhaps the agency needs to then go and have a look at what other reforms are different agencies doing, because it's not just the Department of Social Services. We don't want our kids on social services for the rest of their life. We want them in jobs. We want them doing all sorts of things across the economy. And that's where all of these different reforms, and workplace relations is a big one, need to be addressed.
Thanks, Senator. We will always advocate for people with disability and incapacity we have, so I'm very happy to take on notice and have further conversations with our colleagues in the other departments.